So we're at the end of our treatment. Louise has come in for a low back problem, which is a very common thing that I see, and which is an area that I do specialise in. And generally at the end of a session, following our assessment, which is involved having a chat to Louise, looking at the things that help her back pain, the things that aggravate it, just the history of the complaint, followed by an assessment. So we'll look at how Louise moves, which directions are causing her symptoms, do a full orthopaedic assessment, checking all the nerves, checking everything to make sure we're really thorough in what we're looking at. And then we'll have a feel, and we'll add a feel of her back, how it feels. And now we're just going to talk about what you're going to do in the first week. Because generally in the first week, if you manage your back well, then you can tend to help reduce the symptoms. And what that means is looking at the things that help and looking at the things that don't help, and really diarise that, so be aware of what helps and what doesn't help. Looking at our back, we've got our joints, which come from the back, which can give you pain. The bones sit on top of one another, and we've got our discs. And we've got how our back moves. So if we bend forward, that's the equivalent of these joints will open up and the discs will stretch. As we go backwards, the discs will close down and the joints will close down. That's normal movements, that's what we should expect. But what we shouldn't expect is for our joints to be happy if we spend most of our day with our backs really stretched. That's equivalent of saying, Louise, you slumping. So if we sit like this and our back's really slumped down, if we spend 8 hours a day in that position, what will happen is at some point that's going to start complaining. So what I want you to think about is the principle of neutral. So all neutral is if we take my wrist, it moves all the way one way, it moves all the way the other way. We don't spend our day with our wrist in that position because at some point these structures will complain. We find the midpoint. So let's do that with the back. Let's slump all the way down, arch all the way up, and let's find that midpoint where these joints and these discs aren't put under too much stress. And we're going to try and keep that position whenever we're sitting. 2 top tips for sitting is make sure you sit into a higher chair so the pelvis isn't tipped back, and make sure you stick your bum all the way back in the chair to control it. So that's what I'm going to leave you with today. But the main thing is if we're controlling our movement, then we need to make sure we keep moving. So I'll give you some exercises now to have a look at that. And that's how I would do our first week of assessment on the lower back. Thank you.